Hi everyone, we're going to get started this morning. First of all, thank you so much for logging on for today's webinar. It's our Living Well Online Health Series, Managing Chronic Health Conditions. This web series is brought to you by 5210 Plus, Gallatin County, and Bozeman Health. My name is Danica Comey, and I work at Bozeman Health as the Community Engagement Coordinator. And we are so excited to be offering our online Living Well series, and really thank you for your engagement and participation today. Before I turn the presentation over to Jen, I just want to cover some logistics about using Zoom, which actually, I don't know if we need to do all that because Danelle, you're actually our only participant today, so welcome. So we'll have a little bit more flexibility. If you have questions throughout the presentation, you can unmute yourself and ask as we're going along. We can get a little bit more engagement that way. Usually we wait until the end of the presentation and then have everybody unmute and ask their questions at the very end. But we'll cover just a couple more logistics. The webinar is being recorded. It will be shared on Bozeman Health's YouTube channel. We try to get that posted by the end of the week. And then I encourage you to complete our post-presentation survey, which I will email today after this presentation. Finally, check back for more on the Living Well Online Health Series presentation at bozemanhealth.org/community education. We are right now in the process of planning our June schedule, so that should be up hopefully by the end of this week. You can also follow us on social media. We have Facebook and Instagram accounts for both Bozeman Health and 5210 Plus Healthy Gallatin. Please also follow the health department as well. They have social media accounts on Facebook and Instagram as well. Finally, I'm going to turn it over to Jen. So Jen MacFarlane works at the Gallatin City County Health Department and the Chronic Disease Department. She's active in the community, educating about chronic disease prevention and hosting classes on management of various chronic conditions. So I'm going to turn it over to you, Jen, and I'm going to turn my video off.
Great. Thank you. So just a little bit about myself. Like Danica said, I am a health promotion specialist at the Gallatin City County Health Department. I graduated from the University of Montana in 2002 in Health and Human Performance. I've been working with lots of different populations across Montana and across the age spectrum since 2002, and just really enjoy all of the individuals that I've gotten to meet and to be part of their lives throughout that time. I have a background with physical activity, nutrition, spent some time working in reproductive health, substance abuse prevention, and I really just enjoy my time working in chronic disease self-management and helping individuals live to their fullest while they are dealing with living with a chronic condition. So just a little bit about chronic conditions. When we're dealing with chronic physical or mental health issues, both the health provider's role and ours is different than when treating acute health problems such as the flu, an infection, or something more serious like a broken leg or appendicitis. With acute conditions, the causes, diagnoses, tests, and treatments are usually pretty clear-cut. The health provider chooses what to do, and we follow his or her orders. Acute conditions are also usually obvious or visible. But with chronic conditions, everything is a little more complicated and uncertain. Examples are diabetes, arthritis, chronic depression. These types of conditions can be invisible and are not always immediately obvious. Just because you don't see the symptoms doesn't mean that the condition doesn't need to be managed. Chronic conditions also tend to change over time, so the role of the provider becomes one of a teacher and an advisor, while we as individuals become partners responsible for managing our condition on a daily basis and informing the provider of our treatment preferences. No matter what we do though, we are managing our chronic health condition every day. So if we're doing nothing, we're still managing the condition, if that makes sense. Most of the time we spend dealing with our health condition is not spent in the healthcare provider's office. It's the efforts that we make on our own at home. Many people assume that the symptoms they are experiencing are due only to the disease. While the health condition can certainly cause pain, shortness of breath, fatigue, and so on, it's not the only cause. Each of these symptoms can by themselves continue by themselves contribute to the other symptoms, and any symptom can make other symptoms worse. Symptoms feed off of each other. For example, depression causes fatigue, stress and anxiety can lead to poor sleep, and these can lead to more pain or shortness of breath, and so on. The interaction of these symptoms in turn makes our disease condition worse. It becomes a vicious cycle that only gets worse unless we find a way to break the cycle. Work can be part of this cycle as well. So our work can affect our emotions, and our emotions affect our performance at work. So people who are dealing with chronic conditions and trying to work at the same time face even more challenges. By understanding this symptom cycle and how each symptom contributes to the others, we can learn to use the different tools in our toolbox to help break the cycle at various points. So what you see up on the screen is what we call the self-management toolbox. This is from the Chronic Disease Self-Management Program created from Stanford University. And you can learn more about the toolbox in the Living Life Well series that I will discuss at the end of this session. The tools in this toolbox can be used in a variety of ways to help us manage our chronic conditions and find balance and at work and at home. Today, we're going to learn a little bit about physical activity, using your mind, and action planning to break the symptom cycle. Because we do not have a lot of time, let's get started. So, since you're at home, this will probably be a little more comfortable, but close your eyes and imagine that you're holding a big, bright yellow slice of lemon. Picture it in your mind. You can feel the texture of the lemon rind in your hand. Now lift the lemon to your nose. You can smell its strong citrus aroma. Next, bring the lemon slice to your mouth and take a big bite out of the lemon. It's juicy. The juice squirts all through your mouth. You can taste the tart lemon juice filling your mouth. The juice dribbles down your chin. Suck the juice from that lemon. You can open your eyes now. Think about what happened to your body while you were imagining the lemon juice in your mouth. Some people feel saliva form in their mouth, and they start to pucker in the cheeks of the muscles in the cheeks of their mouth. The puckering and salivation they experience is caused by the mind. There's no lemon present, so it's all in the mind. This is a simple example of how the mind can affect the body with very little effort. Just imagine what we could do if we learned ways to use that power to help us with our symptoms. Now, of course, this would be a technique that can be used to get over some small amount of pain, like climbing the stairs and feeling exhausted from it, or even just getting through a few moments of a wave of arthritis pain in your body. This is not a technique that you want to use if you're having symptoms of a heart attack or stroke. In that case, you want to make sure that you call 911 and get to the emergency as soon as possible. But get over a little bit of pain or to get through a few moments of discomfort, using your mind is a great technique that helps. Another thing that was in our toolbox was physical activity. Physical activity is extremely important for managing any chronic condition. I'm just going to review a couple principles that are really important to get started with a physical activity routine and to get you going and started and built up over time. What I want you to remember is the Be Fit principle. That's thinking about frequency of exercise, intensity of exercise, the amount of time you spend doing it, and the type of exercise that you do. Now I'm going to give you some recommended thresholds to try and reach, but you might not be ready to jump into that amount of exercise right away. So please keep in mind that you want to start where you're at. If you can only do 5 minutes of walking a day, then start with 5 minutes of walking a day. Over time, you'll be able to build upon that and move to a larger amount of time. So with the FIT acronym, F stands for frequency. We want to make sure that we're trying to get physical activity 3 to 5 days a week. So that could be Monday, Wednesday, and Friday. It could be Monday, Tuesday, Thursday, Friday, if you're going for 4 days a week. You want to give yourself rest every once in a while to make sure that you're not overexhausting. But 3 to 5 days a week is a good goal to shoot for. Intensity. Intensity, we're looking for moderate intensity, and this can be measured with what is called the talk test. If you're walking and you can continue to have a conversation with the friend next to you without having to gasp for breath, then you're probably moving at a medium to moderate pace. If you do have to stop and gasp, probably getting a little more intense than what is needed for managing your chronic condition. But if you can sing, then you're not working quite hard enough. So what we want to shoot for is being able to exercise to a point where we can continue to have a talking conversation and not have to gasp for breath. So that's the intensity that we're looking for. The first T in FIT is time. We're looking to work up to 30 minutes of exercise per session. So I should say per day. This doesn't all have to be done at once. If you can only fit in 10 minutes in the morning, 10 minutes at lunch, and then 10 minutes in the evening, that is perfectly okay. That does just as much good for your body as doing all 30 minutes all at once. But make sure that you're starting with the amount of time that you can handle. So in the beginning, if you can only handle 5 minutes of walking or 5 minutes of riding a bike, start there. Over time, we can add to that and get you built up to even more time. And the last T is type. So there's a couple different types of exercise that we want to fit into our normal routine. So cardiovascular exercise, such as walking, riding a bike, swimming, those exercises that build our heart rate up, that is what we're shooting for 3 to 5 days a week. 2 other days during the week, not back-to-back days, but spread out throughout the week, we want to make sure that we're doing strength exercises. This is important for keeping our mobility as well as the strength in our muscles. As we age over time, we lose that strength we lose it a lot easier than we can hold on to it. So it's best to hold on to it as long as we can by working to keep that strength. And finally, flexibility exercises. These should be almost every day of the week, especially those days that you're doing cardiovascular. They can be combined in your warm-up and your cool down, and it just really helps to keep flexibility within all of your joints. So for type, we're looking for cardiovascular, strength, and flexibility exercises. I talked a little bit about building the amount of exercise that you do up. Over time, you want to build at a rate that is not very quick. So you want to start out with where you're at, and week by week, you can add 10% to that. So if you are doing 10 minutes of walking this week, each day this week, next week, you can start adding 10% more to that. So go up to 11 minutes of walking next week. And then the next week after that, go up to 12 minutes of walking. So adding that 10% gradually increases over time, and within no time, you'll be up to the 30 minutes a day. The last tool that we were going to talk about from our toolbox is action planning. And this is probably one of the most helpful things that we learn in the Living Life Well series. So action planning is great because a lot of times when we want to set out and achieve something, it can become overwhelming to think about the changes we want to make or the activities that we want to accomplish. They seem too big to work on all at once, which makes it hard to get started. To help with this, we have action planning. And action planning allows us to achieve what we want or decide to do by breaking down the activity into smaller, more doable steps or tasks. You may be familiar with similar process for when you're at work, but going through all of the steps can help us successfully complete our goals in different areas of our lives. So with action planning, you want to decide something that you want to achieve. It's something that you want to do, not something that someone else wants you to do. It needs to be something that's achievable and action specific. It should answer the question, what, how much, how often, when. And then after you've got that set out, you want to rate your action plan on a scale with your confidence that you can achieve it, on a scale from 1 to 10. If your confidence level is above 7, it's very likely that you will achieve your action plan. And so we're shooting to make an action plan that gives you the confidence of 7 or more. So I'm going to give you an example. So I've been having a lot of pain in my left hand lately, and I haven't been diagnosed with arthritis or anything yet, but because of my family history, I'm a little nervous that I have arthritis in my fingers. And so to take care of that, I am going to set an action plan. And my action plan is, first of all, I'm going to make sure that, one, that it is arthritis. So I'm going to answer the question, what? I'm going to go to the doctor. And I need to probably only go to the doctor once at this point. How often? Just the one time. And when? I want to go to the doctor next week. So I'm going to rate my confidence that I'm going to get that done on a scale of 1 to 10. And right now, with how busy my life is, I think that my confidence level is 5. Now, if we look at that example, with my confidence level being 5, that's not very high. So I have to think about, why isn't that very high? And with how busy I am in my schedule, what if I can't get into the doctor? I'm going to go back and I'm going to change my action plan. So my action plan, I'm going to break it down even smaller. My action plan is that I'm going to make an appointment. So that'll be what I'm going to do. I'm going to make that appointment by calling on Wednesday to my doctor's office, just the one time to make the appointment. And I'm going to make sure that I make that phone call by noon on Wednesday. So what is my confidence level that I can make that appointment? I think it's a 9. I definitely have the time within my schedule to get that done. So my confidence level is 9 that I can make that phone call by Wednesday. So that was action specific. It's something that I want to do, and it's achievable, and it's a step that is going to get me closer to taking care of the pain that is within my hand. Now I'm going to open things up a little bit. Danielle, are you interested in trying out making an action plan for something that you want to do? Okay, well, if you're not interested in doing it over over Zoom, that's okay. I'll just have you think about something. So think about one thing that you want to achieve that is something that can get done within the next week and answers the question, what, how often, how much, and when. And once you have that written down or in your head, rated on a scale of 1 to 10 for your confidence level. You may need to tweak it a little bit to make that confidence level go up. But this is a great tool to use when you're trying to, over time, accomplish a larger goal. You can break down into steps so that you can get pieces and parts of that done over time. So lastly, I just want to review a couple of the community courses that the Gallatin City County Health Department, our chronic disease prevention program, offers within the community. We have a couple chronic disease self-management classes that are specific to specific conditions, such as health coaches for hypertension control and walk with ease. But we also have the Living Life Well series that is applicable to any chronic condition, as well as we may be able to provide the diabetes prevention program coming soon. So Health Coaches for Hypertension Control is an 8-week class, 1 hour per week, and it really helps individuals who have been diagnosed with hypertension or high blood pressure to manage that condition. It's a fantastic program, and it comes with a lot of different tools such as a blood pressure cuff, a pill box for managing medications, and some other great tools for helping you get going on an exercise routine and watching your diet so that you can watch the sodium levels within your diet. The Walk with Ease program is offered in person as well as a self-directed program. It's a fantastic program mainly for people who are struggling with arthritis, but it is helpful for anyone with any chronic condition. And it's also a great tool to get you started on an exercise routine, safely build that exercise routine up over time. Normally when it's not in the middle of COVID-19 pandemic, we meet at the mall Monday, Wednesday, and Friday at 10 a.m. And there's a group that starts out at their own pace, and individuals within that group walk anywhere from 10 minutes to 30 minutes. And it's a great place to socialize with other people who are dealing with similar conditions. The Living Life Well program is the chronic disease self-management program by Stanford University. It's offered across the state of Montana, and it is for anybody living with a chronic condition or their caregivers. And it really goes through the toolbox that we talked about today and the symptom cycle that anybody with the condition could be experiencing. And it helps work through a lot of different commonalities between chronic conditions and individuals who are working to manage those conditions in their life. It's a fantastic program. And then lastly, the diabetes prevention program is something that I don't know too much about yet, but it helps individuals who are maybe teetering on the edge of being diagnosed with diabetes to make sure that they make those lifestyle changes that they need to make so that they don't end up with diabetes. But we do have those courses, and if you are interested in participating in any of those, here is my contact information. Just send me an email down there in the bottom right-hand corner at jenmacfarlane@gallatin.mt.gov, and I can get you on our waiting list for any of those classes. We will be doing a chronic disease self-management class, which was the Living Life Well class, sometime in the late summer or fall, depending on what's going on with the COVID pandemic. But we'll also be offering online Walk with Ease courses and Health Coaches for Hypertension Control courses throughout the next year. Do you have any questions?
Jen, I have a question.
Yes.
Those community courses that you just discussed, are there any age limits or other requirements that folks need to meet in order to qualify for those courses?
No, actually all of the courses are free, which is pretty fantastic because they come with some really great tools that help individuals move towards the changes that they're shooting for in the course. But they're all free. There are no age restrictions. Some of them are not as applicable to, say, teenagers as they are adults who are midlife to aging, but anybody can participate. We have had some 20-year-olds in the Living Life Well course, and it was very applicable to their situation. So it's just dependent on what is going on with the individual themselves.
Great, thank you.
Yeah.
Alrighty, any other questions out there? Excellent. Well, Jen, I want to thank you so much for your time. Thank you. Thank you for being here. I know things are very busy right now. This will be posted to Bozeman Health's YouTube channel by the end of the week. And also stay tuned for an email from Bozeman Health Community Benefit with a follow-up survey. And if you could just take a minute to fill out that survey. Jen, thank you so much.
You're welcome. Thanks for having me.
Thanks.